What do teeth and joints have in common? They both wear down over time. The difference? Teeth can't regenerate, but joints can. That's right, our joints have a hidden superpower to heal themselves, which is something we don't often think about. But if our joints can regenerate, why do so many of us struggle with joint pain, stiffness, and that dreaded creaking sound that makes us feel like the Tin Man from The Wizard of Oz? Well, today, we're diving deep into the world of joint health to discover how you can restore your joints and eliminate pain for up to 15 years. Yes, you heard that right. 15 years of pain free living without relying on medications. Sounds too good to be true? Stick around and we'll show you how. We'll explore the surprising ways your body can naturally repair itself, effective home remedies, the best foods to eat, and expert advice from a seasoned orthopedic specialist. Understanding joint pain and its causes. Let's start with the basics. Why do our joints hurt in the first place? To answer that, we need to understand what joints are and how they function. Joints are the parts of your body where two or more bones meet. They are covered with cartilage, a smooth tissue that acts like a cushion to prevent bones from rubbing against each other. Inside the joint, there is also synovial fluid, which lubricates the cartilage and helps the joint move smoothly. As we age, several factors can affect joint health. Cartilage can wear down, and the synovial fluid can thicken, reducing mobility and causing pain. This is often due to wear and tear over time, but it can also be exacerbated by injuries, lack of movement, or even poor nutrition. Think of your joints like the suspension system in a car. Without proper maintenance, they can start to break down. Now, let's get to the root of the problem. Why do some people have joints that regenerate well, while others seem to suffer from endless pain? The pain you feel is often due to joint degeneration. This can happen for several reasons. Aging. As we get older, our bodies produce less collagen, a vital protein that keeps our cartilage healthy and flexible. Injuries. Any kind of trauma to the joint, like a sprain, fracture, or dislocation, can lead to long-term damage. Lack of movement. Believe it or not, sitting still for too long can be just as bad as overworking your joints. Without regular movement, joints can become stiff and weak. Excess weight. Carrying extra weight puts more pressure on your joints, particularly your knees, hips, and back. It's like driving a car with extra heavy cargo. Your suspension system is going to wear out a lot faster. Vitamin deficiencies. Vitamins like D, C, and E are crucial for maintaining healthy bones and joints. A deficiency can lead to weaker joints and increased pain. And let's not forget about specific conditions like arthritis and osteoarthritis. Arthritis is an umbrella term for joint inflammation that can cause pain even when you're not moving. Osteoarthritis, on the other hand, is a type of arthritis that results from the cartilage wearing down, leading to pain after activity. In both cases, the pain is telling us something's wrong. So ask yourself, have you ever woken up with morning stiffness, feeling like the Tin Man without his oil can? Or maybe you felt a burning sensation in your knees after a jog? Or you can predict rain better than your weather app because your joints start acting up. These are all signs your joints are asking for help. Morning stiffness that eases with movement often suggests inflammation, while a burning sensation could indicate inflammation or even osteoarthritis if it's not accompanied by redness or heat. Understanding these symptoms is the first step in taking control of your joint health. Immediate and long-term solutions for joint relief. All right, let's move on to solutions, immediate relief, and long-term strategies. We all love a quick fix, right? I mean, if there was a magic pill for joint pain, we'd all take it. But here's the truth. Most quick fixes, like popping a pill, only mask the symptoms. They don't solve the problem. So, what can we do instead? For immediate relief, there are a few strategies that don't involve reaching for the medicine cabinet. One of the first things you can do is reduce the compression on your joints. Think of it like letting your body breathe. Compression can come from tight muscles or even poor posture, so stretching and light movement can make a big difference. Exercises that focus on anti-inflammatory movements are particularly beneficial. For instance, yoga or Tai Chi can help improve flexibility and reduce stress on the joints. And for those asking, should I use heat or cold? It depends. Here's a quick guide. Heat is great for stiff joints and muscles. It helps to relax and soothe the affected area. Think of it like putting a warm blanket over your muscles. On the other hand, cold is your go-to for acute pain and swelling. It works by numbing the area and reducing inflammation. A bag of frozen peas can be your best friend after a long day. For long-term joint health, maintaining a healthy weight is crucial. Extra pounds mean extra pressure on your joints, especially your knees, hips, and back. It's like carrying a heavy backpack all day, every day. Even losing a few pounds can make a big difference. Studies have shown that even a 10% reduction in body weight can significantly decrease joint pain and improve mobility. So, if your knees are talking to you, they're probably saying, "Help me out here." Also, try to avoid sudden movements that could strain your joints and wear cushioned shoes. Yes, it's time to retire those worn-out sneakers that have seen better days. A good pair of shoes can make all the difference in the world, acting like shock absorbers for your knees and hips. And here's a golden nugget of advice. Movement is medicine. That's right, movement is also essential for producing synovial fluid, the body's natural joint lubricant. Think of it as WD-40 for your knees. The more you move, the more fluid your body produces, which helps reduce friction in your joints. So, get moving. Even if it's just a walk around the block or some light stretching, your joints will thank you. But remember, it's not about overdoing it. Moderate physical activity is the key. Studies have shown that regular, moderate exercise can help strengthen the muscles around your joints, reducing overall pressure and increasing mobility. So don't go signing up for a marathon just yet. Start with small, manageable steps and build from there. Dietary recommendations for joint health. All right, let's talk about another key player in joint health, your diet. You might not think what you eat affects your joints, but it does big time. Did you know that certain foods can help reduce inflammation and support joint health? It's true. Your diet plays a massive role in how your joints feel. You are what you eat, or at least your joints are. Let's break it down. Omega-3 fatty acids are at the top of the list. These healthy fats are found in foods like salmon, sardines, mackerel, and walnuts. They help reduce inflammation in the body, which is great news for your joints. Think of omega-3s as the body's natural fire extinguisher, putting out the flames of inflammation. A study published in the American Journal of Clinical Nutrition found that people who consumed more omega-3s had significantly less joint pain and stiffness compared to those who didn't. So, load up on those fatty fish and walnuts. Collagen is another superstar in the world of joint health. You've probably heard of it in beauty ads for skin, but it's also crucial for joints. Collagen acts like a cushion between bones, reducing friction. As we age, our collagen levels decrease, which can lead to stiffer joints and increased pain. So load up on bone broths, jellied meats, and other collagen-rich foods. And of course, don't forget protein. It's essential for muscle repair and joint support. Beans, peas, fish, and lean meats are great choices. And here's a fun fact. Gelatin, which is derived from collagen, can also help strengthen your joints. It's like giving your joints a much-needed tune-up. Here's a simple remedy. Mix 2 teaspoons of gelatin with 1/3 of a glass of cold water in the evening. Let it sit overnight, and in the morning, fill the glass with warm water and drink it on an empty stomach. Do this every day for a month, then take a month off and repeat. It's an easy and affordable way to boost your joint health. Plus, who doesn't love a bit of jelly in the morning? But we're not done yet. Anti-inflammatory foods like turmeric, ginger, garlic, and onions can help keep inflammation at bay. Think of them as the Avengers of the spice world, each with its superpower to combat joint pain. Turmeric contains curcumin, which has been shown in studies to reduce inflammation and improve symptoms of arthritis. Ginger works similarly, helping to reduce pain and improve function in people with osteoarthritis. So, spice up your meals. Your joints will thank you later. Home remedies and natural treatments. All right, let's dive into some home remedies. If you're like me, you love a good DIY solution, especially when it comes from natural ingredients. One popular remedy is a simple compress using aloe vera and honey. Aloe vera is known for its soothing properties, while honey is packed with anti-inflammatory compounds. Mix them up, apply them to the sore joint, and let the magic happen overnight. Another effective treatment is pepper oil. That's right, pepper oil. The active ingredient, capsaicin, has a warming effect that blocks pain signals and stimulates blood circulation. When applied to the skin, capsaicin can help to reduce pain and discomfort by depleting a neurotransmitter called substance P, which is responsible for sending pain signals to the brain. But fair warning, don't use it if you have a fever or sensitive skin. You're looking for pain relief, not a trip to the emergency room. Warm baths with sea salt can also work wonders for easing joint pain. Sea salt has anti-inflammatory properties, and when dissolved in a warm bath, it helps relax muscles around the joints, reducing tension and spasms. Plus, who doesn't love a good soak? It's a win-win. To get the full benefit, add 2 cups of sea salt to a warm bath and soak for 20 minutes. Not only will this help relieve joint pain, but it's also a great way to relax after a long day. Consider adding essential oils like lavender or eucalyptus for an extra layer of relaxation and anti-inflammatory benefits. You can also try mustard oil massage for instant pain relief. Mustard oil has natural anti-inflammatory properties, which can help reduce swelling and improve circulation around the joint. Gently massaging the oil into the affected area can provide relief almost instantly. If you're feeling adventurous, you can mix mustard oil with a bit of turmeric for a powerful anti-inflammatory paste. Just remember to wash it off well. You don't want to walk around smelling like a condiment. Expert insights and advanced strategies. Now, here's where things get interesting. We spoke with an orthopedic specialist with over 30 years of experience. Here's what they had to say. The real key to joint health is not just in the joints themselves, but in the muscles surrounding them. Think of your joints as being trapped in a muscle cage. When muscles form knots or trigger points, they create referred pain that feels like it's coming from the joint. For example, tight glute muscles can cause knee pain. Crazy, right? But it makes sense when you think about it. By releasing these trigger points, you can alleviate a lot of the pressure on your joints. It's not just about masking the pain with medications, but solving the underlying problem. It's like untangling a ball of yarn. Once the knots are gone, everything else falls into place. The specialist also emphasized the importance of strengthening exercises. Building up the muscles around your joints provides better support and reduces strain. For knee pain, for instance, focusing on strengthening the quadriceps and hamstrings can make a huge difference. For hip pain, glute and core exercises are key. And don't worry, you don't have to be a gym rat to benefit from these exercises. Simple bodyweight exercises like squats, lunges, and planks can be incredibly effective. Start slow and gradually increase your intensity. Remember, consistency is key. Another advanced strategy the specialist recommended is foam rolling. Foam rolling helps release muscle knots and increase blood flow, which can improve joint mobility and reduce pain. Think of it as a deep tissue massage that you can do yourself. Focus on rolling out your calves, hamstrings, and quadriceps. Start with a few minutes each day and work up to longer sessions as you get more comfortable. So let's recap. We've learned that joint pain isn't just a life fact you must accept. There are real, practical steps you can take to relieve pain and restore your joints for the long term. From maintaining a healthy diet rich in omega-3s and collagen to staying active and using effective home remedies, you can transform your joint health. Remember, your joints are like the hinges on a door. Keep them well-oiled and they'll swing freely for years to come. And remember, joint pain doesn't have to be a life sentence. With the right care, foods, and exercises, you can enjoy up to 15 years of pain-free living. So what are you waiting for? Give these tips a try and let us know how they work for you in the comments below. Have any personal remedies or exercises that have worked wonders for you? Share them with the community. We're all in this together. And hey, if you found this video helpful, don't forget to hit that like button, share it with your friends and family, and subscribe to our channel for more health tips. Your joints will thank you, and so will we. Here's to 15 years of pain-free movement. Stay healthy, stay active, and keep those joints moving.